in my practice, we treat every single patient from mixed dentition all the way to adults, young patients and old patients. When you do the heavy lifting at the beginning, meaning when you correct the sagittal problem first, like a career motion appliance, then you can expedite the treatment by finishing faster. So meaning if you correct the class 2 or class 3 first and then finish the case with braces or aligners, I think in my opinion you finish the case faster. So that is called treatment planning. So when you visualize the end before you start, when you finish the treatment by doing the difficult part first and then doing a very simple treatment at the end using braces or aligners, I think is the way to do it. And talking about the speed, you can finish the treatment faster. So we're always shooting for 12 to 14 months in our practice. Big practices that have a lot of employees, most likely starting a case right away is very easy. For small practices like mine, for example, I like to do my treatment planning, my digital rendering, a good diagnosis, not only for the teeth, but for the airways and TMJ, and then I start the treatment. So that is called doing the homework first, and then you continue with the treatment. However, when you know that the class 2 is the problem, the main problem, and you can start delivering the motion appliance first, the same day of the consultation, sometimes that brings the patients faster into the clinic and kind of like a prevent that the patient say, oh, thank you for your information, and go to another practice. And that is that a lot of people are scared of that. So in my opinion, it goes both ways. You know, I would love to start a case right away, but sometimes I need to order an appliance, so I need to do an Essex, and maybe I need to do something first. But for me, I like to do the diagnosis first. So I like to use 3D imaging. I want to make sure that you have bone, for example, to move teeth so the lower incisions will not flare, match. And so I do my homework first. So I like to do that, but I would love to start cases same day. Treating class 3 patients was the most difficult task in orthodontics at one point, you know. So until I started to treat patients with the motion appliance. So in my practice, class 3 corrections are the easiest, rather than the most difficult task in our practice. So the motion works extremely well for class 3 correction, but you have to diagnose again. So it is all about, if it's a skeletal problem and maybe a surgery is the solution, sometimes the motion is not going to work as good as you're supposed to. But when you do a diagnosis and you really apply the forces the right way and you correct the class 3 tendency that you have, I think the motion appliance class 3 is the solution that works the best in my practice.